I'm joined by Stephanie Washington. Thank you for being with me today. Stephanie is a member of DHSS's Diversity and Inclusion Work Group, and she's also the HIV planner and evaluator for the Bureau of HIV, STD, and Hepatitis. And thank you so much for being here. We are going to talk today about some great efforts that Black Americans have made in public health. Such a great time to be doing that now. It's Black History Month, and also the last year, public health has been under a spotlight for sure. So,
definitely.
So thank you so much for diving in with this with us.
Thank you so much for having me, Miss Lisa, on this bi-monthly episode of the DHSS Dose, and for allowing me a second round opportunity to highlight Black History Month and discuss some of the major public health accomplishments founded by some of our African American brothers and sisters. I truly want to focus on showcasing African Americans who have contributed to public health efforts as we're in the midst of our COVID-19 pandemic. I feel that now is a more appropriate time as ever to educate the department on several of the discoveries that people of color have made to American society and public health as a whole. Of course, I have to begin by representing the field of work that I'm in, which is HIV, STD, and hepatitis prevention, and start by telling you about a gentleman by the name of Dr. William Hinton. Born in 1883 to former slaves, Hinton went on to Harvard, where he earned his Bachelor of Science degree in 1905. He taught at Harvard and several years later earned his doctorates. Dr. Hinton's love resided in surgery. However, due to racial prejudices, he was barred from practicing in Boston area hospitals. So he returned to Harvard, where he was offered a position to perform autopsies on individuals who were suspected to have perished from syphilis. Dr. Hinton later mastered his work by becoming an expert on the infection and developed a blood test, later dubbed the Hinton test, which greatly improved the accuracy and reliability of the diagnosis of the infection.
Wow, that's pretty incredible. You said, I think 1905, way back then.
Correct.
And that is still impacting your work personally today.
It is, yeah,
Very
absolutely.
cool.
I know, right?
Yes, very interesting. What's another great public health success that you learned about?
Yeah, so another individual that I definitely want to highlight is Dr. Regina Benjamin, former U.S. Surgeon General. During her 4-year term, she served as the 18th U.S. Surgeon General from 2009 to 2013. So Dr. Benjamin shifted the national focus from a treatment-based to a prevention-based perspective, highlighting the importance of lifestyle factors such as nutrition, physical activity, and stress management in the prevention of chronic diseases. Other campaigns during Dr. Benjamin's term targeted breastfeeding and baby-friendly hospitals, tobacco use prevention among youth and young adults, healthy housing conditions, and suicide prevention. Her efforts have proven crucial to healthcare in general, as we know that a prevention-based approach to treating individuals is far more effective at heading off chronic diseases like diabetes, heart disease, cancer, chronic lung disease, stroke, chronic kidney disease, and Alzheimer's. So when we compare this practice to a treatment-based approach, so we know that poor health outcomes and higher medical costs are the result of providing medical treatment to someone who is already sick, as opposed to preventing the actual disease from occurring on the front end.
Okay. And our current Surgeon General, also African American man, has guided us through this pandemic. It's good to see all of that progress being made. I think you have one more story for us that's really interesting, in my opinion. Please go ahead and tell us about it.
I have to tell you about this one. Lastly, and most notably, is the introduction to the thought of vaccines and the development of medicine. I actually had no clue that a 1700s Boston slave whose master named him Onesimus, a biblical term meaning useful, helped assist the world in eradicating the deadly infection of smallpox. During my research, I learned that Onesimus was captured and brought on a slave ship from the Caribbean, And during that time, smallpox was ravaging the city and the world. Onesimus saw other slaves becoming infected with the disease and thought that by purposely exposing healthy slaves to the virus, that it would create an immune response that would protect healthy people from becoming sick. And he was right. And he began to conduct this procedure of rubbing the pus from a smallpox infected person into the open wound of a healthy person within the slave population. He told his master, Cotton Mathers, a Protestant minister, who asked other slaves and verified that Onesimus did in fact conduct this procedure known as inoculation. Mathers went on to learn that this procedure was used in Turkey and China, and he began to perform the procedure on residents in the Boston area. It worked again. The practice was criticized initially because the concept came from a Black man. However, the technique set the stage for later vaccine development, and now the practice of vaccination is widely used throughout the world. And as of 1980, the World Health Organization officially declared smallpox as eradicated, and it all began with a Black man.
That is fascinating.
Yes.
It really is, and I'm shocked I didn't even know that before working on this with you. That's just incredible and so timely. I mean, all we're talking about right now is vaccines with
Right.
COVID-19, and to know where it all originated from, and to know that smallpox is considered eradicated because of its work, it's truly fascinating. So thank you so
mind-blowing.
much for bringing that in, helping educate DHSS on all of the work. It's such a great time to be celebrating Black history
Yes.
and all the amazing accomplishments and how that's impacted us working in public health. So very much
Absolutely.
appreciated, Stephanie.
Thank you. I appreciate you having me.
Thank you.